Hi, I'm Juhani Capeding, representing the Philippine Society of Public Health Physicians in the 2024 WFPHA Fellowship Program. So the reason why I wanted to join the fellowship was I wanted to learn as much as I can from other public health associations around the world. And I think as a representative of the Philippine Society of Public Health Physicians, I think as a growing community of public health practitioners, I think we can learn a lot and maybe get some insights and best practices from other more mature organizations so that we can provide a better experience, more value for our members, and perhaps to also strengthen the organization's role in forwarding all our goals locally and nationally in terms of public health in the Philippines. In terms of what I've learned in Norway, I think the biggest thing or the biggest realization that I had talking to people there, talking to public health practitioners and researchers, people who do public health policy making is that even though we might be worlds apart in terms of, um, let's say, the resources or the political climate, um, we also experience sort of the same set of problems. The biggest takeaway for me is in Norway, um, they also decentralization plays a large role in the administration of health services, and it's the same thing here in the Philippines. Um, so I think I took away a lot. I'm sure I would definitely apply a lot of the things that I've learned from the people who I've talked to during the fellowship, and I think there are some strategies or insights that we could apply here. So that was very fascinating. In terms of what I did on a daily basis, well, basically it was most of the fellowship was composed of different meetings, formal and informal meetings, talking to different public health people in Norway. So it could be over, let's say, a meal or coffee. It could be a formal meeting with presentations in their offices. So there was a wide variety of different settings that I was able to interact with all these public health practitioners. So yeah, so it was a great experience. And in 3 days, I was also able to experience, of course, the city, um, different cultural activities, and also was able to also join um, some conferences. It wasn't some one of the conferences that I attended was a conference on digital health, and it wasn't really planned, but the opportunity came up, and I am super thankful to the Norwegian Public Health Association for being able to connect me with the organizers. So I got a free ticket out of that. So that's essentially the whole month. So yeah, and so it was great. During the free time, I could reflect on the previous day's conversations, um, write down some stuff for our future action plans here in the Philippines, and then yeah, it was a great experience, very much fulfilling, and a lot of reflections were made along the way. Public health is important because I think it definitely plays a role in improving the lives of people. You really can't have development or progress without a healthy population. And I think public health plays a big role in that. I also believe that public health is an opportunity for us to connect people with different insights and expertise to work on a single problem or maybe a set of problems. I think this this notion of a public health expert is a bit how do I say it? It's a bit misleading because I don't think there's any one expert in public health. Usually, you have different expert from different areas who would pitch in order to address a problem being tackled in public health. And I think that's where the magic happens, talking to different people, talking to people with different expertise and experiences, bringing everyone together and then getting a better grasp of what the reality is. So I think as an area for focus, public health is important, but it's also sort of an arena or a platform where people from different experiences and insights can go together and address a an important problem. So yeah, I think that's why public health fascinates me, and public health is really important in terms of nation building. I would definitely recommend public health associations around the world to join the WFPHA and to join the fellowship program in particular. I think being connected to colleagues from different countries, it highlights the differences between context and also the similarities, and just reflecting on these differences and similarities brings about, I think, the best insights um, with whatever issue that you're currently facing in your in your current work or for your organization. It also definitely helps a lot that you get to meet such a group of wonderful people who are also passionate with public health, and talking to them for hours about public health issues, their fascinating experiences in working in public health. So I think personally at that level, I think it's a great opportunity for anyone who wants to represent their public health association. For the World Federation of Public Health Associations in general, I think they play an important role in connecting um, different countries, and becoming an organizing voice for this public health associations. I've I've hopped on some of the global annual meetings of the world of the federation, and I think yeah, hearing the insights from different countries on different topics on public health really brings about um, an interest, several lines of conversation, interesting conversations, and yeah, it's always good to talk to different public health associations, representatives from public health associations around the country, around the globe. Sorry. So yeah, yeah, it's definitely we're a global community, so we definitely need to connect with each other and work with each other, especially in these um, um, situations where um, crisis don't just hit one country but hit regions or the whole world. So yeah, working together, an opportunity to provide a singular voice for public health communities around the world is very important. So I would say be more active. I would say, I personally say that I would like to be more active in the federation, and I would enjoying others to do so too. Well, I would really like to thank the Norwegian Public Health Association for the opportunity, the care, the time that they um, spent with me when I was doing the fellowship. So I'm really happy that I was able to make new friends. So it's not just in a professional setting, but connecting personally with the people who have the same interests and same advocacies as we have here. It was really an enriching experience. So yeah, I would like to thank NOFA, and also of course the WFPHA for organizing the fellowship. I hope we can have more fellows, more opportunities for cross country collaborations in the future. I think it would be really helpful for everyone.